Hello, welcome and kumusta, and thank you for joining me today. I'd like to talk to you about the parameters of assessment and intervention. So, what does that mean? These parameters are the parts that you would look for whenever you're doing assessments and whenever you're doing some intervention as well. Okay, now these parameters is always applicable and will always be applicable for the problems that relate to occupational performance, particularly with ADLs or activities of daily living. Just to remind you, your main focus as an occupational therapist is ADLs and a person's ability to engage in ADLs. And when you assess their ADLs, or say personal care, you look at these four aspects. The first aspect is the independence or their level of independence. So, for example, a person, say, let's talk about grooming. So you measure the person's, you assess their grooming, and you describe their independence. And there are levels of independence. So there's total dependence all the way to maximum dependence, moderate, minimum, and full independence. You can grade it in that respect. But from my experience, I have noticed that the parameters or the descriptors of independence in the country of United Kingdom or in England is dependence, assistance of one, assistance of two. So that's how most people would understand the level of independence. So for example, dressing, you measure their level of dressing, but you describe it. Now, I am a little bit biased on the descriptors of independence because I've developed an outcome measure called Cambridge ADL and Rehab Measure. And the level of independence are described in 5 points, where 5 is independent, 4 is setup or modified independence, 3 is supervision, and this is for those people who are just supervised, just verbal assist only. 2 is for assistance of one or standby assist of one person. 1 is for those people who needed 2 people for moving and handling purposes, assistance of 2, and 0 if the person needs a special dependence and it has to be a nurse that will have to perform the task. So it's a special method of doing it. Okay, so that's the first parameter, independence. The second parameter that we look for is safety. Now, safety is an aspect that comes along with engaging ADLs and even work. Now, this is a little bit tricky because there's really no guarantee of safety. So you can only get the subjective report of the person about the safety, and you can ask them how safe they feel they are while they're doing their task. You can put like aspects that would look like things are going to be safe, but it still is not a guarantee that a person will be safe. For example, if a person is particularly with showering, if you install a grab rail so that the person will be safe, you can only say and you can only assume that the person will be safe with the grab rail being there, but there is no guarantee that the person will not slip or will not fall. So the best way to describe safety with regard to performance is you ask the person, and you can use a 10-point scale. For example, ask a person, say, showering. On the aspect of showering, you can ask them, if you're showering, put a score on how safe you feel you are while you're showering, where 0 is not safe and 10 being very safe. So you can put it in that on that style. It's just like a visual analog scale. So we've spoken about independence, safety, and then the next and the third, the third part of the parameter of assessment intervention is the parameter of adequacy or quality. Quality being pain. Are there aspects of the component that is pain? Is pain there? And then the next thing would be the level of fatigue while they're doing the task. Or the last one would be the amount of time that they have to do to complete the task. Yeah, so this is adequacy and quality. So for example, say putting on their clothes, top half dressing. Say the patient managed to do the top half dressing, but they can do it in 30 minutes. You do dressing practice again with the objective of them being able to do it at a faster rate. So that means the faster they do it, that is your measure of success. Or for example, if they're able to, say they had a shoulder replacement, so the problem is they can put on their clothes but with pain, and then your objective will be patient will be able to put on their clothes with reports of lesser pain. And you can do this by teaching them some one-hand dressing technique or some modified techniques. Okay, so that is independence. You've spoken about the second parameter, which is safety, and then the third parameter, which would be adequacy. Now, the fourth, which should have been the first one, is the parameter of value. You address things, or ADLs, you do things for the patient because they are the things that are of value for them and to them. So for example, they are with you and all of a sudden, say they ask you for some information about where to get some blue badge, for example. So the problem there is not knowing, and the problem needs to know. So the problem does not know where to obtain information about blue badge. That's the problem. Your objective then, the patient will know where to obtain information on the information about blue badge for parking. And then once you've given them the information, which is education and signposting, the outcome then would be patient now knows how and where to get the blue badge, which makes the patient, you and the patient, achieve their goals. This is, you've done this because it is a matter of value to the patient. So in summary, you can put all of these parameters into one acronym, and that is VISA. VISA, where V stands for value, I stands for independence, S stands for safety, and A stands for adequacy. And when you think about adequacy, you talk about the speed that they do their ADLs, the amount of pain that is there, and the level of fatigue that that consumes them. There you go, guys. That is the parameter of assessment and intervention. I hope you have learned a little something out of this. I am your occupational therapist. If you like this, pass it on to your friends, pass it on to your colleagues, and talk about it. Start talking about it. Do talk about it, and do some scenarios and do some problem solving and case studies using these parameters of assessment and intervention. Until next time, bye.